Hi everyone. So I have the honor of introducing to you Dr. Amol Sood, INICET, November 2022, rank 31. Awesome performance, a DAMS Foundation student, a brilliant boy. I'm very proud of his achievement. Amol, tell me, what was your
Thank you,
first
sir.
reaction when you saw the result?
Sir, I was very pleased and also surprised because I did not expect such a good rank, and I was very happy.
I think that is the most important thing, that you should be happy. And who was more happy, you or your parents?
Uh, all of us were very happy, sir.
Brilliant. Everybody's super excited about it. Now, Bache,
Yes, sir.
I want to tell you today that whenever you get a good rank, okay, it is one of the things we should always do is, and we should always acknowledge is that, it's like the hard work of your parents that has all culminated into this kind of success right now. And,
Yes,
they are super proud. I can tell you as a
yes,
parent, when
yes.
our children do well, we feel so happy. Okay. So, Amol, I want to know from you a very important question. Which set did you appear for? What was your set in the paper, morning or evening?
I appeared in the evening set, sir.
Evening set. And how many
Yes.
questions did you attempt?
I attempted 175 questions.
Okay. Do you think that was slightly on the lower side, considering now that you must have seen all the interviews and discussions that have happened? Most of the people I have interviewed had attempted more than 190.
Yes, sir. So, what I personally feel is that one should attempt those questions which one is reasonably sure of, and if one is making any guesses, there should not be too many of them. So that was my experience from the AIIMS undergraduate test also. So I had attempted only these many questions then also. So so I think I attempted only those questions which I was reasonably sure of. That's why probably I left quite so many.
So, what may work for one may not work for another. We have already seen on this channel so many high achievers who have done more than 190. And here we have another high achiever, Dr. Amol. He was on a more conservative side, but he still made it good. So, there is no set
Yeah.
formula. It is about what you are comfortable with. And I would like to
Uh,
advise to all the listeners that whenever you give your grand test, give it with either with aggression or with a defensive approach, and then titrate to your final approach, so that you are as sure as Dr. Amol is. He is very sure that he has to go into a certain manner, and that has got him a top rank. Amol, also tell me, what was your opinion of the difficulty level of this year's paper and the subject wise distribution?
I think it was. Okay, I mean, not too difficult and not too easy. Like I had done the previous year's questions, so it was quite similar to the previous year's questions that I had done.
Do you think that doing previous year questions and those topics always helps in the INICET exam? I think.
Yes, definitely, because what feedback I had got from some seniors whom I had asked about my about while before preparing was that you should always do the previous year's questions because several topics tend to be repeated, several questions in themselves tend to be repeated directly, so they are very important to do.
And you have been a part of dance foundation course in your third year. Do you think starting early helped you to, say, get into the drill of the competitive exams?
Yes, definitely. Because so I'm from AIIMS Delhi and I joined DAMS in my third year along with the rest of my batchmates, and I found that the classes were really nice. So they kind of help you to get an idea of the topics that you need to focus on, so that even while reading from the textbooks, you can focus on those topics more. So that helps.
It gives you the direction, actually, that, because
Yes,
when we are reading, and especially in medical science, in MBBS, the curriculum is infinite. So when we are
right.
reading on our own, we may not know, is it important, is it not important. But when you have, attended a lecture, you know that, okay, these are the core things, and then you can build upon it. The sky is the limit on how much you can understand. But the problem is time. that we have limited time,
Definitely.
so we need to know, we need to have a guiding hand, and that is where the foundation course kind of helps. And Amol,
Definitely.
were the notes that you made in the foundation year, could you use them for your final revision later on?
Yes, I definitely used those notes, and they were very helpful for me. I used them while revising the topic.
Were they easy to revise?
Yes, I had forgotten some bits of them. So, those bits which I had forgotten, I sometimes referred back to textbooks if I could not understand the whole thing. But since I had revised them during my third year also, while after coming back from the classes, so it was okay to revise them. I mean, not too difficult.
How many revisions were you able to do?
I actually didn't do a lot of revision. I revised the notes once, and for the topics which I thought were important while doing the previous year's questions, I read them once again with the while doing the previous year's questions.
In this particular exam, do you think that the if I look at the May exam was more skewed towards the first second year subjects, and this time I see more balance in the paper, and
Mhm.
especially when I look at my own subject, radiology, has I see some resurgence. And usually before INICET, I'm thinking that they will not put clinical, they put only first second year. This time clinical images were also there. Do you think
Yes, yes.
that helped the paper level, that students could see the clinical edge to it? Because May exam was like genetics and genome, and this was more practical. What do you think?
So I had not attempted the May exam actually, but yes, this exam had a lot of clinical questions. So definitely, if someone's clinical knowledge is sound, then they would have found it easier.
And Bache, tell me that if there is any journey that we talk about, when people have performed well just like you have done, it looks as if it was easy, but I'm sure
Yes.
there must have been ups and downs. So how did you manage your ups and downs and the changes that happen during the preparation phase? Sometimes we really want to give up only. How did you manage that?
So my parents were always there to motivate me. So they said that you can, I mean, you have already done it once in while joining AIIMS Delhi as an undergraduate, so you can do it again if you want to join it as a postgraduate student. So my parents, my grandparents, all of them played a very important role.
I think the support of family is the key buffer for Dr. Amol's, exam preparation, and that is very
Yes,
important. Actually, that's very important. If you have somebody who can just pep you up and say, "कि तू कर लेगा,"
yes,
and then you push it. Did
yes.
you ever visualize this while preparing, that one day you will be in a top 50 bracket, and was it like, uh, or like, was it a surprise for you?
Uh, I didn't really visualize this, but yes, I was happy to get this result.
और अमोल, कुछ कहना चाहते हैं उन लोगों को जो इस एग्जाम में अच्छा नहीं कर पाए हैं, लेकिन अगली बार पेपर दे रहे होंगे या नीट पीजी का पेपर दे रहे होंगे, कुछ मैसेज उनके लिए?
Yes, yes. I would say कि don't give up. It is very important to keep trying hard, and your competition is only with yourself. So if you can get a better rank next time and do better than you did this time, then that is all that counts, because ultimately your competition is only with yourself.
I think very beautiful line. It is not with the others that your competition is. Your competition is with yourself. You need to do
Yes.
better every single day. Beautiful words, Dr. Amol. Amol, I also want now to ask you that, a very important question. Many people would want to know, which branch would you take now, or you want to take?
Actually, I'm not sure, because I want to talk it over with my parents first. Both my parents are also doctors, so I'll talk it over with them. I mean, the result only came yesterday, so we are still just celebrating and this kind of thing. So I'll talk it over with them and then decide. but I'll definitely take a
Definitely.
clinical branch.
Is it possible to say a quick congratulations to them if they are around?
Uh, so actually, I came to a separate room to get this recording done, so they're they're not here at this moment.
Okay. Okay. You want to take your computer there and maybe surprise them, or I can wait. I have the entire day with me. I think, but it will be a
Uh,
very good surprise moment for them.
yeah, no, actually, I'm in a kind of separate. I mean,
Okay. Okay.
they
Okay.
they went somewhere else while this interview
Okay.
was
No
going
problems.
to take.
Just
Yeah,
convey my regards and congratulations
thank
to
you, sir.
them. And I
Thank you,
wish
sir.
you all the best, beta, for your future. I wish that you get the branch of your choice in the place of your choice. Keep
Thank
rocking,
you so much.
keep shining, and always keep reminding yourself of the line that you told others. Okay. The key word is you have to be a better version of yourself every single day. I wish you all the best. Really proud of you. God bless you, beta.
Thank you so much. Thank
God bless you, beta. Bye, beta.
you. Bye, sir.